Hello, everyone. I'm Dr. Shela Hirani, Associate Professor at the University of Regina, Faculty of Nursing, Canada. The title of my today's presentation is Effects of COVID-19 on Breastfeeding Practices of Immigrant Mothers in Canada, a Qualitative Study. Disclosures. I acknowledge that there is no actual or potential conflict of interest. First of all, background. There are many vulnerabilities that are associated with the time of the COVID-19 pandemic. The COVID-19 pandemic has increased the vulnerability of mothers and young children, mainly due to the lack of opportunity to have a regular contact with the healthcare providers, especially during the initial waves of COVID-19. And also this was a time period when most of the mothers in Canada specifically were having the inaccessibility to the breastfeeding counseling facilities in general. And in this regard, there were no face-to-face contact that were available during that time. Worldwide, the COVID-19 pandemic has created many challenges for the immigrant families who are with the young children, and mainly those challenges were due to the substantial impact on the employment, economic burden on the families, especially after losing the employment. There were growing food insecurities, marital issues, domestic violence, and subsequent effects of the parental distress on the child's positive emotions. Specifically in Canada, that welcomed large number of immigrants from different parts of the world, they were also having a number of challenges, especially among the group of the immigrants who themselves face lots and lots of the social isolation while being in a new country. And many of the times the immigrants are not very well aware of the healthcare systems. And specifically during the time of pandemic, many immigrant families were facing add-on challenges if they were not familiar with the healthcare systems, and especially with the COVID-19 protocols that were currently followed in the healthcare settings, as well as there were a number of limitations surrounding the financial implications, the job finding, the economic hardships were the key challenges that were even keeping many mothers away from the healthcare providers who can offer them the good breastfeeding counseling facilities. Many immigrant families also were not very proficient in the English language proficiency most of the time, and they also faced the add-on challenges. Talking about the immigrant families in one of the provinces in Canada, which is Saskatchewan, this province has a noticeable increase in the immigrant and the refugees family that are with the young children. Most of the immigrant families that migrate to this province are mainly from Asia, South Asia, Africa, Europe, Middle East, South America, and Central Asia. There were few literature that identifies that how refugee and immigrant population were specifically badly affected during the time of COVID-19 pandemic, especially during the first wave of COVID-19, because they face more barriers to the socioeconomic support, healthcare, education, and border crossing impediments that were also directly and indirectly affecting their well-being. In the Canadian context, however, there is a significant gap in the knowledge surrounding the effect of COVID-19 on the breastfeeding practices of the immigrant mothers who are with the young children. And it is really, very essential to look into this component because breastfeeding is a lifesaver, and especially during the time of COVID, the breastfeeding was quite essential, and not many mothers were actually getting the healthcare support in terms of the breastfeeding counseling facilities available in general. And only like patients needing the emergency care were entertained in the healthcare system. And most of the diversion of the healthcare was on the screening, on the treating the patients and helping the patient who were actually with the COVID-19. So the immigrant mother, one of the vulnerable group, were one of those that really required more attention. But unfortunately, there are knowledge gaps surrounding their breastfeeding practices in general, and it was essential to explore their experiences to better respond to their challenges and initiate the need-based intervention for this vulnerable group. Therefore, the aim of this study was to examine the effects of the COVID-19 on breastfeeding practices of the immigrant mothers in Saskatchewan, Canada. We undertook the critical ethnographic study in order to identify the range of challenges. Also, we tried to identify both the positive and the negative effects of the COVID-19 pandemic on the breastfeeding practices of the immigrant mothers in Saskatchewan, Canada. So as I mentioned, we undertook this study in this province and invited the participants from all over Saskatchewan so that mothers who were with the young children and they were immigrant, they can participate and share their perspective. We collected the data using the in-depth interviews, the field observations, as well as we reviewed few documents, especially the health reports and the available statistics, the breastfeeding counseling facilities that were not offered at that time. And we also reviewed few websites if they are the one who are offering any kind of the information on COVID-19 and breastfeeding or not. And that's how we triangulated our findings to be able to have a very good analysis drawn from our data. And the sample included the 30 immigrant mothers having the young children of age 1 day to 24 months of age, and we interviewed them using the semi-structured interview guide. We received the funding from the Saskatchewan Health Research Foundation, and our collaborators included the United Way Regina, Saskatchewan Health Authority, Regina Open Door Society, and Saskatoon Open Door Society. Now the findings. Now, the first theme in our finding is on the quality time with the infants. Many immigrant mothers mentioned that during the time of pandemic, they were at home, so they devoted more times toward their babies, and they were happy in a way that they were getting more time to bond with the baby and breastfeed them. So here I would like to share a few quotes from the participant as I quote, "The only benefit of COVID-19 is that I spent more time with my family and can breastfeed my baby," unquote. Another participant shared, as I quote, "Due to COVID-19 pandemic, I was at home most of the time. This helped me to breastfeed my baby," unquote. So these quotes are reflective of the fact that mothers got more time with the baby. But on the other hand, there were various other negative aspects of COVID that were directly and indirectly affecting the breastfeeding practices of our immigrant mothers. Immigrant mothers also reported that they faced more isolation and they had the lack of support in general from their extended family members as well as from the hospital and community. And they were feeling more isolated and depressed because they were not getting more of the breastfeeding support from people in their social environment. Here, mothers identified that social support from them have really been so much helpful to sustain their breastfeeding practices in general, even in their home country. But while being in Canada during the time of COVID-19, they had lesser support from their social environment. One of the participants quote, as I share, "Due to COVID-19, we stayed home in isolation. I couldn't see anybody, couldn't invite anybody, and couldn't go anywhere," unquote. Another participant shared, as I quote, "I was about to give up. I was a first-time mom and no one was allowed to visit me at home or in the hospital," unquote. This reflects that how much mothers who were immigrant really missed the support from their extended family members, especially even the spousal support that they were really looking forward at the time of their labor and delivery experience while being in the hospital. That was also something couldn't be a possibility due to COVID-19 restrictions. Here, the other theme that we came in from our data was on the limited healthcare access and lactation counseling. Here, participants share that they also face the difficulty in accessing the healthcare and breastfeeding support, and that was something that really affected negatively on their breastfeeding practices. One of the participants, as I share and quote, due to COVID-19, the majority of my appointments were over the phone. Even when I had concerns on breastfeeding, they were still heard over the phone, unquote. So here participants were more worried because at times with the breastfeeding, if the mother is with the clogged duct or with the breast engorgement or with mastitis and with any kind of the infection that really requires a kind of a direct contact and direct observation by the practitioner. And if the mother are like being asked to describe those presentation while being over phone, that all the time is not a possibility. Also, one of the other participants shared, as I quote, it would have been nice if a lactation consultant could come to my house, but because of COVID-19, it was impossible, unquote. So this further reflects that somebody with the lactation expertise having the direct contact with the participant was not a possibility, and that really affected many mothers who were unable to access the healthcare settings or the healthcare providers face to face and seek the breastfeeding support as needed. Another participant quote before I share, here I would like to share the theme on the mother-baby separation. Many participants shared that this was something that they faced while being in the hospitals during the time of COVID-19. Many mothers who had the babies who required the NICU care, and they were actually the one who were in the NICU, and mothers were asked to leave the hospital after their labor, after 1 or 2 days of the labor, and then mothers were the one who had a longer separation from their babies who were in the NICU. And that was a time when the breastfeeding guidelines were not very much clear that whether mothers should breastfeed or not, and even express breast milk wasn't allowed in the hospital, and mothers faced more challenges. So here one of the participants' perspective, as I share in quote, after my childbirth, I tested positive for COVID-19. At the time, I was sad because I didn't have the chance to carry my baby immediately, do the skin-to-skin contact and breastfeeding my baby. I was somehow depressed and sad, unquote. This also reflected that even the mothers who tested positive for the COVID-19 and were immigrant, they were also in the situation of frustration because they had to be more in the isolation. And even at that time, not many mothers were made aware that they can still breastfeed while using the mask. They can even have their express the breast milk and give it to the nurses in the hospital. And that was something, another layer of the gap with the mother-baby separation affecting the breastfeeding practices of immigrant mothers. Another theme was on the hospital restriction, and that was also affecting the breastfeeding practices. And one of the participants quote, as I share and quote, after giving birth to my baby, restrictions on visitation caused postpartum depression because you don't have needed support and people to cheer you up, unquote. So here mothers were also facing the postpartum depression because even during the transitioning time of their child's birth, and those immigrant mothers who were very new to the country and it was their first baby, and even nobody was allowed with them in the hospital, really made them more sad and stressed out. Mothers further mention on the financial instability during the time of COVID-19. Many immigrant mothers actually mentioned that either their spouses and they themselves lost the job, or if they were the newcomer, it was so difficult to find the job to financially support them. And that was a time when they had a low income and they were buying the food which is of not the good quality. They were eating less and they were feeling more fatigued during that time. That was directly and indirectly affecting their breastfeeding practices. One of the participants quote, as I share in quote, I had to stop breastfeeding and look for a job as my husband was laid off due to COVID-19. Financial hardships, loss of employment, and lack of financial assistance from the government made it difficult to pay rent and feed the family, unquote. So here are a few general recommendations from this study. And we really recommend that during the time of the pandemic, it's really essential to promote, protect, and support the breastfeeding practices of the vulnerable group of immigrant mothers because they face the add-on challenges due to limited social support, isolation, and financial instability in a new country. Our second recommendation is that it is essential to involve the immigrant mothers and their family members as a partner in designing the innovative and need-based programs that can fulfill their needs and promote their physical, mental, social, and emotional health, especially during the time of the pandemic. Our third recommendation is that during the time of COVID-19, the use of social media, helpline, and telehealth is recommended to provide the mental health support, skill building program, nutritional counseling, and follow-up care to the immigrant mother in their preferred languages. Our fourth recommendation is that the partnership and collaborative efforts by the interdisciplinary professionals, governmental and non-governmental organizations are really important to extend the social support, facilitate the resilience building, promote the mental health, and build the capacity of the immigrant mother during the time of COVID-19. So here is the knowledge translation video. Here is the link, and I really encourage the audience to watch this video and share it with the other global healthcare providers and the other people involved in the global health, because this video actually summarizes the entire perspective that how mothers' experiences are being shaped, especially surrounding their breastfeeding practices and how they get the impact because of the COVID-19. Here are a few of my publications. If you're interested in accessing the full text article, these are the open text articles already available. But if you need it from my side, you are most welcome to reach out to me. Here are the references of my today's presentation. I would like to acknowledge like patient partner, study participant, all my research assistant and collaborator, and funding from Saskatchewan Health Research Foundation. Here are my contact details. If you have any question, you are most welcome to email me at this address. Thank you so much for your attentive listening.